I've had a cheap meal. It's fucking Coca-Cola. So yeah, I'm just doing a short update really. I won't be on longer than probably 10 minutes tonight. I won't say I'm feeling poorly, because I'll just say I've noticed a few changes today. I've had a right side wheeze. I've done a bit of physio when I did my nebulizers, so I've got a lot of stuff up there. And today, obviously, I've had 1 day break from my IV medication, and then I've gone straight onto the gentamicin, what I've got left. So I've done a full day gentamicin. I'm going to keep my eye on this wheeze, because it's not really bad, but I noticed it's come back. It's always the right side, so yeah. It's not, like I say, it seems to go when we clear the mucus from the chest, so it doesn't seem to be something that's going to be affecting me like 24/7 at the moment. But what I need to do is keep my eye on that. That way I can either get a rescue pack of steroids, or just be, doing a bit more nebulizers and using my steroid inhaler. So that's it. I only felt like it about two hours ago. I was sat down and I just thought, I got a bit clammy, and my mum always has the fire on because she's old, so I got a bit clammy. Then I started realising I had a wheeze, so I thought, you know what, I'm not going to have my tea now. I'm going to do my nebulizers, so I went and done them. And before I jumped on the gentamicin, I had about 5-10 minutes of physio, just getting rid of whatever's there. It seems to be the same stuff I was bringing up anyway before my IVs. It's not green, but it's like white and fluffy. And if you've ever seen like bacteria on a fish, like you get this white growth. That's what it looks like. So it's not always your sputum has to be green. That's nonsense. Doesn't have to be discoloured. It can even look clear and you still grow something. So just keep getting them samples out. So say for instance you feel a bit crap, this is what I go off. Sometimes the body tells us before it can be detected in the lab. So what I'll do, I'll send a sample out, and then say for instance it says micro, was it pollen or plorant, whatever it says, no bacteria grown, natural flora or whatever it is. I'll say, okay, that's what it's saying now, but I guarantee you in 2 weeks time it's going to be showing something. So I'll send another out then, and then surprise it comes back with bacteria isolated. All right there, Danny Pranks, you okay, mate? Just using a bit of this cheap Vicks. Put it there on my moustache. And if it don't work, it'll incinerate my moustache. Yeah, so, alright there, Renell. Welcome to the channel. If you've not subscribed, hello there, Jan, so please subscribe, because we try to grow this channel. There is a lot of turmoil going on in the lung world, especially people like ourselves who depend on IV cycles of antibiotics, and it seems to be that, they're not treating us unless we isolate a sputum, which is your phlegm from your chest or your nose, wherever, and you put it in a sample and it detects it, which is wrong because there's so many other ways they can, find out not find out what infection you've got, but they can find out if you've got a bacterial infection by a simple blood test, checking for CRPs. So yeah, it's absolutely a joke at the moment. Danny, if you're on here trying to prank, mate, you're on the wrong channel. So probably get more views than you. So I'll give you one more chance and then you go, mate. What's your thoughts about men's rights? To be honest, I think women have too many rights. I think we've turned into a world now where men don't have a say in anything. So I do think men's rights is going to put. Obviously, we're just a second-class citizen now. Women are independent. Women can do masculine jobs. Women think they can be mother and dad. So, where does that put us? All right, Ronzina, welcome to the channel. So we need to go back to that old generation where a woman was a woman. Doesn't mean she had to be stuck in the house, but she was a housewife. She did the basic chores. The man was the provider. The man was the one who disciplined. The mother was the one who loved. You get what I'm saying? Because if the mother tries to act like a father, then the child doesn't get that. What's the word for it? Doesn't get that thing that a father gives, because a mother can't give what she's not got. so she hasn't got father instincts. All right, Damien, mate, welcome to the channel. I'm a British female, and I believe the old school ways were a lot ways nicer. What do you mean, the old ways? Just explain a bit there, mate, because I might be missing what you're trying to say. So yeah, I just think we need to go back to basics. I think we're told what to think and feel as a parent, and if we go outside that, you know, outside what is it, the Rubik's cube or that, we'll just say, then we're wrong, because now we're being told how to parent. So whatever our fathers, our grandfathers passed down generationally, we can't go off that anymore. We have to go off what's written in a book, you know. And like I say, this dog is pissing me off. Give me a second. Some idiot round here has got a dog. He leaves it outside. Right. Shut up. Sorry about that, mate. It won't good for the video. Like what we were saying, I like that men were men and women were women, yeah? Men don't get as much... No, they don't, mate. So say, for instance, a man goes homeless. Okay, he's left to go for a family member, a friend. If a woman's homeless, now, we're not going into rights, who's right and wrong. We'll just paint a scenario. Two people were in love, they fell out, and then one had to leave. It's very unlikely the woman with the children's going to leave. So the man's going to do what a man does and says, okay, I respect that, I'll go, kind of thing. So there should be something in place that if that happens, that the man has rights and he should be rehomed. He shouldn't be thrown out on the street. He shouldn't be a beggar. He shouldn't have to sofa surf. So yeah, men's rights is not very good at the moment. And yeah, I think they've given all the power to the women. So it's a tricky dynamic, innit? Yeah, a lot of people don't want to get into relationships because of this. A lot of people don't want to get married because of this. So yeah, see, this happens with friends. They were told to get on with it on the streets. They were a man. It's just the thing, isn't there? There's not enough houses to house everyone. Not everyone's got enough money to buy a house or even rent it or whatever. So when you're sharing bills, life's a little bit easier, I believe, if you're sharing the bills. And you both, you both have your moments. Every couple has these moments, but you work it out. I think this is the era we're in. I don't think we know how to work things out. Years ago, there was no social media. So if things broke loose, he'd go to the pub or she would go to bed and then it was sorted in the morning. There's none of that now. A basic situation which should just get cut once it's done with, move on, you wash the pots, I'll put the computer on, kind of thing. Them days are gone. And that's in everyone's relationship. We can just spread the news, and then you could have some nosy person who's messaging, how are you getting on with your fellow? How are you getting on with your fellow? So it might not always be the person just going back to everyone and saying, listen, I'm having difficulties. Sometimes these nosy twats have got nothing to do. You know what I mean? So we're in a different era. Like I say, years ago we could take our phone off the hook, things like that. Now we can't. We're glued into social media, which isn't a bad thing because you get to see my Bronchiectasis channel. But any more questions? I don't mind talking about things that are away from the lungs. But I've got the fire on here and I'm sweating. In America, I know the men's rights is a lot worse than over here, I believe. I remember that there was let's call him an influencer. I'm not going to mention his name. Into natural bodybuilding, and he actually owned his own property. I don't think it was an apartment. I think it was a big property, and his partner rang the police on him. So the guy saying, "Look, it's my house. I have the rights to this house. She needs to be taken out my house, not the other way around." And he got taken out of his house, and that was in America. I didn't follow up the story, but I'm thinking, deal with a court case, deal with an investigation. But if it's that man's house and she's not married to him and she doesn't have any rights, then how can you tell the man to get out of his own property? And that was I'm sure it was America. The guy speaks with a Belgian accent. What was his name? I can't remember. But yeah, see, I'm not anti-female. I'm not anti-male. I just don't like male activists, female activists. I just like a woman to respect a woman and a woman to respect a man, vice versa. 50-50. Yeah, that's the way I see it anyway. Because then what we do, we have a split culture divide where the feminists are going to defend the feminists and the men are going to defend the men. And then you're at war with each other. So I think we need people on both parties to say there's good in men, and the women to say the men to say in the women there's good in women. But anyway, like I say, so today we went to the local hospital down where I've got my chest clinic, and someone special to me. Okay, I'm not going to put anything else who it is. Has had a lot of problems lately, especially with her breathing. Her heart rate's been bad, and they've been holding back on medication. And this person recently did a breathing test, and she's holding 300% more oxygen than she should be expelling. Now, with this new stupid rule about the sputum having to be collected and tested in lab, has now put her IV cycle back nearly 2 months, and this woman is struggling. So, we went in, we spoke about things, and we said this isn't on. We don't mind giving a sample, of course, but you've got to do other stuff, see how the patient's doing. The oxygen sats aren't great, the heart rate's up, and now you're causing more stress to this person because now you're saying we can't give you your medication now because you've grown nothing in the sample, which is wrong. So this is the fight, really. This is the fight that we've had for a very long time with bronchiectasis. If you don't know what bronchiectasis is, it's similar to cystic fibrosis, but it doesn't get taken as seriously. Even though we grow the same bugs, even though we feel the same way, it doesn't get taken seriously. And I believe it to be for the simple reason is they say people with bronchiectasis can live a normal active life. With that being said, it depends how bad the bronchiectasis is. It also matters how young they are. You know what I mean? If they're young, maybe from 16 to maybe 21, 22, yeah, as long as they live a decent lifestyle, exercise when they can, eat good food, and get the medication when they need it, they'll live an okay life. But as you get older, with any condition, it declines. It declines rapidly, and bronchiectasis is one of them conditions. So to try and say to a person who's been on medication for 10 years, who relies on them, that we're going to pause it, and the bullshit that comes with it is antibiotic resistance is nonsense. Yeah, I feel like it's a Russian roulette with everyone's health at the moment. Diabetics, people like ourselves. Yeah, no, it's called bronchiectasis, mate. It's on the increase. Basically, it can happen. It can happen at any age. You can be born with it. Don't know what's going on with your head. I'm sweating. Yeah, you can be born with it. What else? Or you could have like repeated chest infection, then causes narrowing of the bronchial tubes, and then the lungs get flooded with the mucus, and the mucus then builds. It clogs all the bronchial trees and branches, let's call it that. The lungs gets flooded, and then it becomes very difficult in removing that mucus. So they give us stuff like this. Obviously, this looks a bit more scary than my neb mask, but that's what I have to do. I have to do this twice a day, like that. And that's an antibiotic twice a day for the rest of my life. On top of I need clinical antibiotic IV therapy, which is what you see in the hospitals through the IV bags, 3 to 4 months, every 3 to 4 months. So it's not an easy battle. And if you compare that with a cystic fibrosis patient, you'll see it's very similar. Yet it just gets brushed down the line because a lot more people are getting it. So it may even replace the old asthma. You're gonna find a lot of people who got diagnosed with childhood asthma, yeah, like in the 90s, reporting with these problems, and now because of the CT scanning machine, they're gonna find the bronchiectasis. So, a lot of people may have bronchiectasis and not know. it may take something really bad to happen, like it did with me, where I had a bad pneumonia, nearly went to about 7 stone, 8 stone, and then I had to see someone about 2 weeks after that, and then I just told her about my childhood. I told her like I'd be bringing mucus up, but because my dad smoked and he brought mucus up, I just thought this was the norm, you know what I mean? I thought everyone brings mucus up, and it was only when I was in high school, I remember it to this day, I just coughed a massive chunk up. I think we was going from class to class, and I was with one of my friends, Shane, and I remember it, and he was going, nearly being sick because he realised the chunk I brought up, and that's when I had a bit of like a flash moment, like, ain't this normal? Why is he reacting like that? And then as I got a little bit older again, bonfire night, things like that, I used to really trigger my bronchiectasis off. You know, the smell of it on my clothes, the smell for days later, because, you know, it used to stay in the air. I'd have chest pain when I breathed in. I actually was on a, a terbutaline inhaler, which is about this size. You twist it and you breathe in deep. Now, at the time, I didn't think, because I was breathing in deep as a child, that it was normal to get chest pain, and I was getting a lot of chest pain. So little things like that, mate. I mean, you know, chest pain's normally the one, or chronic chest infections that gets a follow-up, and then they find out whether it's a cystic fibrosis or a bronchiectasis case. I'm in my late 20s, and I've got diagnosed with asthma randomly, one small lung. Do you obviously struggle daily? Yeah, struggle daily, mate. It's, you might have a good day here or there, you know, but as you get older, the far and few between, and at this time of the year, it's rampant what you're going to get. You're going to probably catch, in my case, I can catch different types of bugs. Some people are lucky in the sense that they only grow 1 or 2 bugs. Well, I've had in my life 6, 7 different bugs, which is classed as bronchial sepsis. So it means the lungs are fucked. And with that being said, also colonizations. And what colonizations are, is this is rooted in this person's lungs. So even if we treat it, it's going to keep coming back anyway. So I have 3 colonizations, I think. So, you know, it's not an easy, you know, on the outside looking in, people might say this person looks okay. But if you look at the scientific evidence, you realise this person isn't okay. Yeah, it is serious, mate. You know, I built this channel years ago, and I built it, and I used to push a lot out there. I tackled the British Lung Foundation because I felt like they were doing articles on bronchiectasis just to wind people up. So they would get a person who could run half a marathon, or someone who completed the 10K. And I said, what you're doing, yeah, it's bringing good news, it's bringing good press to bronchiectasis, but then that's belittling people. That's discriminating against people who have a severe bronchiectasis that couldn't compete in any marathon, 5K. I know someone who can't even walk from the couch to the bathroom downstairs, which is less than 10 meters. I'd say it's about 3 meters, without being out of breath and saturations going up and things like that. So I wasn't having this British Lung Foundation at the time taking the piss out of us. I said, run a story on me. I said, why don't you run a story on me now? I've been hospitalised all this time, and I'll give you a bigger picture of the neglect that's going on in the world of bronchiectasis. And you know what they said? Okay. They told me to write in. When I wrote in, guess what? They didn't come see me. They didn't take no interview, no reports. So British Lung Foundation, mate, if your whole purpose is to, you know, gather donations and not pump it into bronchiectasis and just pump it into cystic fibrosis, emphysema because there's lots of smokers, just don't run stupid articles on bronchiectasis patients. They could do that. They could do with that someone with asthma too. A lot of other conditions, bit weird they did that. Yeah, mate, You can't win with them. You think you're getting somewhere with them, and then they don't want to give the bigger picture what's going on with the bronchiectasis because they like to keep the funding elsewhere. So the best way I can describe it is like it's an umbrella of funding. So a lot of money gets allocated to lung diseases, yeah, and bronchiectasis is low down. It's almost the handle on the umbrella. And we're always going to be there with this mindset. So I don't like to pump money into it. I'd like to do what I'm doing now. And you know, we've had a few campaigns. We had no longer neglected by the NHS. We made a few mugs, made a few wristbands, and you know, things like that. But I even wrote to Professor James Chalmers from the Edinburgh University, who does a lot for lung disease. He didn't get back to me, but I sure know about a year later there was lots of things being pumped into bronchiectasis, such as the willow treatment, which is a tablet that kinds of destroys bacteria differently than antibiotics. So the tablet causes like an explosion to the bacteria. So things are good. Right, I'm gonna go soon, but I'll just read your last couple, mate. Have you heard about that rash in the UK too? They're saying it's scabies, but I don't believe it. I've not heard that. I'll search it up there. I'm interested in that. I've heard about something that there's going to be a bad pandemic again. I think campaigning to get more known is a really good idea. I would keep doing. Yeah, that's if I have people helping. I wasn't doing it myself, mate. We had a few people join and help, and we had people doing things for us. Again, let's see how we can take off in the new year. Like I say, I need more people to, you know, subscribe. I need more people to be like-minded. I need to hear people's stories, if they don't mind telling me, you know, in the comments, how's your life been with bronchiectasis? How's your life being young with a lung disease and not being taken seriously? Right, thank you very much there. AUK, you give me a lot to speak about, mate, but I'm feeling a bit drained. Like I say, I've only been off antibiotics 2 days. Well, off clinical antibiotics, and now I've gone back onto gentamicin, so I'm feeling a bit tired. And I'm going to rest up. I'll catch yous again. Guys, please subscribe.